Hi, this is Dr. Michael Chaikin at the Center for Optimal Health in Plymouth Meeting, Pennsylvania. Today we're going to review the hidden but extremely important concept of compartments. The compartments in the human body includes the blood vessels, the cells, the spaces between them, tissues such as muscle and liver. To best explain how compartments work, let's use the metaphor of your financial status. If we looked inside your wallet today and we saw that you had $3,000 in your wallet, that would not necessarily mean that you are wealthy. You could be hundreds of thousands of dollars in debt. On the other hand, if we looked in Bill Gates's wallet, we would probably see no money, but we know that he is extremely wealthy. So clearly, if we look inside the wallet, we are not going to get an accurate picture of someone's wealth. You have to look in the right place. So we have to look at assets, real estate, at retirement accounts. All of that gives us an idea of what the person's wealth is. So we can look at, instead of money, look at your wealth of magnesium. Where we look for magnesium in your body will give us different results. And then we need to know the relevance of these various compartments and their relationships and how to use this information to guide diagnosis and treatment. Let's now look at case one. This person is in their 60s, living in a nursing home because of a neurological condition, and this condition causes symptoms of muscle spasm. So here we look at the magnesium level and we see that it's the magnesium in the serum. That's the part of the blood that is separate from the actual cells. It's the liquid of the blood. And we see that there are 2.3 milliequivalents floating in the blood, and when we look at the normal range, we see that this is at the higher end of the range. So this level is suggesting that this person has normal or high normal levels of magnesium and therefore does not need any. However, if we simultaneously look at the amount of magnesium in the red blood cells, we see that the range there is from 4.2 to 6.8. And this same person on the same day at the same time has a low level and they're actually deficient in magnesium. We'll talk later about the risks of being deficient of magnesium and other nutrients, but the point here is that we're getting two different pieces of information. One says that the person is adequate or high, the other is saying the person is low. So which one do we listen to? In this case with magnesium, there's a good scientific body of information that says the intracellular or the red blood cell magnesium test has more clinical relevance than the serum test. Moving on to the next case, this is a 15-year-old boy from France who has neurological problems, spasms, and pain. Even though these results are in French, you can pretty easily figure out what they're telling us. Here's magnesium plasmatique, that's obviously in the plasma or the blood. They give the results in two ranges, it's just different units. We see that this boy is at the upper part of the range. So again, magnesium looks adequate in the serum, but here in the globule, which has to be the red blood cell, we see the value is substantially lower than the lower limit in the normal range. So he is pretty significantly magnesium deficient. In this next case, this person's serum magnesium is high, but their intracellular magnesium is normal. This demonstrates that you can have many different permutations of these results, i.e., whether these levels represent adequate magnesium or excessive magnesium. In this next case, this person not only has low magnesium intracellularly and also has a low red blood cell zinc, while the serum zinc is normal. What's also very interesting, unrelated to the zinc and magnesium, this person was taking too much selenium for quite a long period of time without testing, and we see that both her red blood cell levels and her serum levels went quite high. We did monitor these and they came back down. At no point did she have any symptoms of selenium toxicity. We were watching for those. And we're finding that high levels like this usually are not associated with what you will read as signs of toxicities of these minerals. My interpretation is that these ranges are all skewed low because there are global deficiencies of most of these minerals well documented in the literature. So we probably can be at least 2 times higher than many of these values, and even more so without being toxic. We actually might need those higher levels. Another is B12. B12, when supplemented by mouth, very often will go sky high in the serum, and it scares people. However, we've had a number of patients with neuropathy or energy complaints or severe rashes and joint pains where if they take B12 by injection, regardless of the blood test, we see substantial and consistent improvement with that treatment. And if the B12 shots run out and the person goes back to using oral, the symptoms come back. So we see in that case that the serum level when high does not tell us anything at all. When low, it's meaningful, but when it's normal or high, it's not meaningful. This sort of approach applies to virtually every nutrient in our body. In some cases, the values are extremely accurate and valid. In other cases, the values are only indirect or are only valid under certain contexts. That is why it's better to always integrate these values with the clinical situation as well as the subjective and intuitive information provided by both the patient and the doctor. Finally, I would like to briefly mention a few of these nutrient deficiencies that we have identified in our practice over the years that are proving to be powerful in healing. These include magnesium for muscle, heart, bowels, energy, brain, B12 for neuropathies, dementia, toxicities, rashes, and other strange neurological or immune complaints, lithium for brain function, as well as probably for detoxification, selenium for liver, thyroid, detoxification, and other, iodine for not only thyroid but also all estrogen requiring tissues, including breast, ovaries, uterus, and prostate, niacin for brain, energy, detoxification, cholesterol, joints, gums, and a whole host of other possible areas, and several others. One of the key questions is why don't more doctors do these tests? And there's no easy answer to that question. Even cardiologists only test the serum magnesium, and that's usually only when the person is in an ICU environment and had a critical event occur. Obviously, we want to take action before those critical events occur, and this can contribute to that. There are research articles in peer-reviewed journals listed on the federal government database that demonstrate a relationship between the heart attack rate in a community and the level of magnesium in that community's drinking water. These sorts of studies regarding many of the nutrients are quite available and yet not being utilized in treating patients. There are associated videos on lab interpretation. Thank you.